amongst the crowd. I practice up the road by the Belmore train station in Belmore. I practice geriatric medicine, primarily almost 100% Medicare-based, so I know what government-controlled health care is all about. Let me tell you what I'm not, and I know that you're not either. I'm not part of a mob. I wasn't sent by the healthcare industry. I wasn't sent here by any insurance company. I wasn't planted here by any right-wing conspiracy. I am not a Nazi. I'm not a racist. And I'm certainly not an idiot. What I am is a concerned citizen as you are. We deserve to be listened to. Government is a good thing when it's limited. It protects us, gives us security, and protects the downtrodden and lays out a safety net. But when government tries to take over, government is a bad thing. Our government has based their healthcare policy on false science and deception. I practice medicine. I've been in this community for 27 years. I know what the practice of medicine is. They are basing it on deception. Just like the cap and trade issue, they base it on a false science, or at the very best, an unproven science. This climate change, this global warming. We don't know what that is. We don't know if it exists, but they base their energy policy on false or unproven science. Likewise, in the healthcare industry, it's all based on deception. They tell us there's 46 million uninsured. There's not 46 million uninsured. A good portion of that are good citizens, young, healthy citizens, who elect not to buy health insurance. They can afford it. They decide to buy a car or a TV or whatever else an American wants to buy. They elect not to buy health insurance. That's a very large portion of the so-called uninsured. There's the transiently uninsured. People are uninsured when they lose their job. They will become insured again when they get a new job. And there is a solution to that doesn't require a government takeover. There's a good portion that are Medicaid eligible but are not in the system. These are downtrodden people who deserve to be helped. They already qualify for government plans. They're not in the system because the system is so complicated they can't understand how to get in, or they're too lazy to get in, or they're just uneducated by our public health system. We need somebody to educate the people to tell them that they're qualified to be in the system, and they don't need the government to take over the rest of the system. There are illegal immigrants. That's a whole other issue. Now, I am for legal immigration. I think immigrants are the backbone of our country. But illegal immigration, it's a whole other issue, and I won't get into that now. I don't know whether we have a responsibility to ensure their health care. Now, there's the truly unfortunate people. There is a segment of the population that are truly uninsured. And we are good citizens, good Americans, very charitable, and they deserve our help. But to turn over the entire system to the government to help the poor, unfortunate, uninsured is a crime. Now, I'm not anti-government. I practice geriatric medicine and I use the Medicare system. I deal with government every day. Government should regulate, not take over. The debate really is whether we want the government to control the cost of health care or control health care. I say we want them to control the cost of health care. There are things we can do. The debate really is health insurance reform versus government control and takeover. The pro-Obama argument is deceptive. They tell us that if they set up a public option, code word, single payer, that will increase competition. That's fake. It's a deception. It's false competition. Nobody can compete against the government who deficit spends and raises taxes to do so. They don't have a profit motive. Our insurance companies will go out of business. They tell us they're going to save money by pumping trillions of dollars into the system. We all know that's nonsense. I was going to say something else, but we'll say nonsense. Save money? Look at Social Security, Medicare, the post office, the military, cash for clunkers. Some of these systems are necessary and they work, but they all deal in deficit spending, cost overruns, every one of them. That's government-run entitlements. They also tell us to trust them. They will not ration care. Nonsense. Rationing will become necessary. Sarah Palin probably overstated, and she took a little brief for it when she called it a death panel. But there is in the bill that's gone through the House a panel of benefits, a benefit panel. That benefit panel is made up of appointees, not elected officials. Appointees, mostly appointed by the president, according to the House draft. And we know where the president stands and his cronies. This panel will decide who gets what benefits. They will ration care. They will also encourage end-of-life decisions. They will mandate discussions by the doctors. I do that already. I don't need the government to tell me what to do. So, I told you what I'm against. Now let me tell you what we can do to truly control the cost of health care, to reform health care, not to take it over. First and foremost, tort reform. Malpractice reform is essential. Now, malpractice law is a necessary evil. There are true victims of malpractice, as in every field, every profession, there is corruption, fraud, and abuse. But in every field, there's not nearly the kind of corruption, fraud, and abuse that there is in the government and in politics. If we reform the healthcare, the tort reform, the tort industry, the malpractice industry, first of all, Obama tells us he will take that off the table. That's not even on his table. He will not even discuss it. Why? Because the lawyers control the government. Why? Because the lawyers run the government. Most politicians are lawyers. So this kind of malpractice liability reform, tort reform, is essential but will not be discussed. What we need is tort reform.